I'm Dr. Pri, and this is the Longevity Now podcast, where we distill insights from the frontier of longevity and preventive medicine to help anyone live healthier for longer. There's a lot of questions of what is changing with AI and how's that going to change medicine. Of course, one of the things is that people, everyday people, consumers, patients are able to look up information themselves and get answers a lot more quickly on demand, almost for free, depending on which AI you're using and which model you're using. And that is awesome. There's also a question as to how this changes the role of the doctor. A lot of talk on that online. I won't get into the doctor side of things, but I will tell you from my perspective, what is the best LLM, the best consumer AI for healthcare. I asked the question of a bunch of different LLMs, what is the first line of treatment for someone with a blood pressure of 130/85, which, as you'll remember, is elevated because of that bottom number being over 80. And this person also has a BMI of 32, which implies that they have weight they can lose. And then I also asked it as a kind of a secondary question, what assessments would you do first for that person? Now, the goal of this is not to necessarily go through the algorithm of reducing blood pressure. The goal of this is to show to you what are some of the different options out there for LLMs and how good are they across a few measures. So access, meaning who can actually use these LLMs. Speed, how quickly do they give you an answer, or does it take a while to think about it? UI, how easy is it to understand and take in that information that they're giving you? And then finally, quality, how accurate is that information based on how at least I think about doing a blood pressure reduction on a patient who has it a little bit too high. And spoiler alert, we're looking for it to tell us that lifestyle should be the first thing that we do. Right? We don't want it jumping straight to medication. Not only is that bad medicine, that's not what most people want out of their healthcare. So 5 different AIs I talked to. I talked to a free version of Grok. I talked to ChatGPT. I talked to OpenEvidence. I talked to one called UptoDate, and then one called DoxGPT. Now, the last 3 you may be a little bit less familiar with because they are a little more doctor specific. And so one of them was a clear winner. I'll tell you which one. The 4 criteria we are looking at: access, speed, UI, and quality. Access. Let's start with Grok, which you're seeing on the screen here. Grok is global. Anyone in the world can use it. It's free, but you need an X account. Although I will say with an X account, that a free X account, I was able to use its expert thinking, which was great. Contrasting that with ChatGPT, also global, also free for anybody to use, but you can't use the thinking mode. It's only the fast mode that you get. So the answers are presumably not as good. We'll assess that in a second for this question. Recall the question here: what's the first line of treatment for someone with a blood pressure of 130/85, BMI of 32. All right, now one you may not have heard of, OpenEvidence. This is only for people in the US. If you use a VPN though, you can get in, and anybody can use this, meaning you don't have to be a doctor, but you're limited to a couple searches a day if you're not a doctor, and it's free. And specifically a doctor in the US. You have to verify it through an ID called an NPI number, which is basically an identifier for doctors and other types of practitioners in the US, like nurse practitioners and physician's assistants. Okay. UptoDate. This was traditionally a tool used to look up information by clinicians. They have their own AI here as well. This is, I believe it's global. It's hard to find that information. Technically, anybody can use it, but it's $60. So for non-clinical users, it's a $60 for a monthly subscription here. Then the last one I mentioned, DoxGPT. This is for only verified US clinicians, but it is free. So it's more similar to OpenEvidence, except OpenEvidence, you can get a couple messages. I don't know, I guess a day, a couple messages you can get if you are not a clinician. All right, so that's the access side. We got a couple consumer ones, a couple clinician-facing ones, and one that's sort of partially open to people who are not clinicians. Now, next, let's talk speed. This is one that in retrospect, they're all pretty fast. Grok was a little bit slower at first because it was using the thinking mode, and all of these have thinking mode. ChatGPT really fast, OpenEvidence very fast, UptoDate a tiny bit slower than OpenEvidence, I would say. DoxGPT was also a little bit slower than OpenEvidence, so that's a quick criteria to go through. Now we've talked access, we've talked speed. Let's talk UI. For me, this is a personal thing. UI, what user interface, what this really means is how long does it take for me to think through and understand the answer it is sending me. Of course, if you write a more detailed prompt, you might get the answer formatted in a way that's a little bit better for you. But I'm busy. I have a lot of questions to ask. And part of the value of these LLMs is I can ask more questions. I don't necessarily want to spend a longer time on each question. I want to be getting that answer quick. Starting with that, Grok, not very good at this. This was a lot of text, difficult to read, decently formatted with bullet points, but it took me a while. So I even followed up with it and said, please summarize these recommendations to be stepwise and more succinct. I would say Grok did the worst. That was probably because it was in its thinking mode. So there's a trade-off there. ChatGPT, really good formatting, I would say. So great job on that. OpenEvidence, this was great too. Very succinct without me asking it to be. And that I actually found very helpful, and good use of bold letters there. UptoDate was also decent, a little more than I wanted, but not bad at all. And DoxGPT was actually a little bit better in terms of the formatting. Now, let's talk about the actual quality of the output. What got the answer correct? Starting with Grok. I gave Grok a 6 out of 10. It was a good stepwise algo. And again, it's easier to read it in the succinct output here. But it didn't have everything that I was looking for, and it didn't fully make sense. So what a lot of these are saying here is you need to first confirm the diagnosis. Great. Completely agree with that, of the diagnosis of high blood pressure. Then you want to do a history and a physical exam. Not sure how much the family history is going to matter, to be honest with you. Then you want to do some laboratory and diagnostic tests. You're unlikely to see something in a blood pressure that's just slightly elevated that makes you say, oh, we got to change a bunch of stuff. And really, a lot of this is for medications. So I don't know if you necessarily need to perform all these tests. And it says one good thing here that some of them didn't, which is consider an echocardiogram, which is more invasive. You're going to have to order it, you're going to have to schedule it. It's going to take a lot more time. Stratify the cardiac risk, and all of these will tell you if the risk is too high, then you want to start on a medication. I think this is where you have a conversation with the patient about the medication. None of them got that. So that's one of the punchlines, is that it's not going to be quite as good as a clinician. And then initiate lifestyle modifications, and then add pharmacology. Try lifestyle alone for 3 to 6 months if the risk is low. So pretty good. I gave it, and then follow up and monitoring. I gave it a 6 out of 10 because I felt like it was doing a little too much, adding these tests a little earlier than you necessarily need to. And it also didn't go into too much detail on the lifestyle modifications. Like if this is the first line, I want to know a little bit more about this. All it says is do everything that we talked about, reduce your sodium, lose weight, increase aerobic exercise. Like that's just not practical. So I gave Grok a 6 out of 10 on the quality of it. Good, but not fantastic. ChatGPT was the worst. I gave it a 3 out of 10. I know it's a little bit harsh, but the algorithm was confusing. It was jumping between first do lifestyle, but then make sure you think about which medications to start and get all these labs before treatment. But wait, am I treating or am I doing lifestyle? I won't go into it too much, but I felt like it didn't explain a lot of things very well. And as I mentioned, this was not the thinking mode on ChatGPT. So that might have been part of the difference there, that it didn't really have the time to ingest that information. But keeping in mind that the Grok thinking mode did take longer, and it didn't output it in a way that was really easy for me to read. OpenEvidence, I thought, actually did this really well. So a couple things it did well. It hit all the main points, make sure that the diagnosis is correct, start with lifestyle medication, and then initial assessments considering the history of family and personal hypertension, cardiovascular disease, which again, I think it's fine to do it. I don't know how much if it changes what you do. Consider laboratory and diagnostic testing. and then pharmacology if indicated, not telling you that you do need to do pharmacology. So I thought it did a good job of summarizing this stuff. I didn't give it a 10 out of 10 because, it did mention some of the details, recommend 1 to 2 kilograms per week of weight loss, which is a lot, by the way. The dietary sodium restriction, it's telling us to do all of these things. I don't think that's necessarily practical. Interventions reduce systolic blood pressure by approximately 5 each. I don't think that's quite accurate either. So I think it could have done a little bit of better job there. But in general, I felt like it was a good sequential stepwise of what I would do in this scenario, in this situation. UptoDate Expert AI. I gave this one a 7 out of 10. It also had the proper algorithm. It had more lifestyle changes, but it didn't explain how much of a change in the blood pressure to expect from those lifestyle changes, which I was really looking for that. I think that's really helpful to help determine which ones to prioritize. And then I liked that it didn't go straight to the medications. It says reassess in 3 to 6 months and then consider medications. I thought it was overall, maybe could have been fleshed out a little bit more compared to the OpenEvidence one, but overall pretty good. And then the DoxGPT, I also gave it a 7 out of 10. I like it had all the steps of the algorithm, that it went to lifestyle first. I like that it was maybe a little too extreme again with lifestyle modification. You're not going to get somebody to change all this right away. I think that's just not realistic. To summarize, I thought OpenEvidence was the best. I thought it was the best because it's more accessible. I feel like it did really well on the speed. It did really well on the readability, the ability to understand that information quickly. And I also thought OpenEvidence was probably the most useful. I thought the other medical ones were close in terms of getting all the information. And this kind of makes sense because they're all trained on the guidelines. That being said, these different tools, they're not accessible, right? You have to be a licensed clinician to utilize them. And OpenEvidence is mildly accessible. The general ones, I thought the Grok thinking mode was better. I do think it's still a little confusing to take that and operationalize this. Like if I didn't know what I was doing, if I hadn't been seeing patients, that would be a little bit tougher to do. So the conclusion to me overall is like these are really helpful tools. It expands my reach as a doctor because I can quickly figure out what to do in a situation that maybe I don't see all the time, and therefore help a patient in front of me instead of having to send them to another clinician. For you all, if you are able to access OpenEvidence, I would totally do it. I know it's only a couple queries you can do a day, but get that VPN, utilize that one, because those are really trained on the clinical guidelines, and that's going to get you more accurate information, and there'll be fewer unknown unknowns. If you're going to use a model like Grok or ChatGPT or Gemini or Claude, I would make sure to use it in the thinking mode to get a higher level of quality as to the answers that you are looking for. Ultimately, somebody who has experience taking care of patients with one of these tools is going to be better than any of these tools alone. And this, it shows you here the utility of having a model that is specific to a certain domain, whether that's law or finance, or in this case, medicine. You are going to get better quality output from those, and a expert human utilizing those can take things to another level. That's why I didn't have any of these as a 10 out of 10. But overall, it's fantastic to have these tools. And I hope that this helps you see what is out there for you that you could potentially use to help yourself.